the 11th anniversary for Medical Monday. And we couldn't do it without each and every one of you, so thank you very much. I want to welcome Dr. Anthony Vacca. He is new to the Reid team, and he's our new pulmonologist. Well, he's in pulmonology, and he came from Illinois. And we're happy to have him, so Dr. Vacca.
I think we lost our pictures.
Yeah.
Thank you. Good afternoon. Thank you for having me. There's just a couple disclaimers. I'm not a professional speaker, so we're going to make this very informal. If there are questions you have while I'm talking, if you don't understand or I say something that doesn't make any sense, please just stop me and we'll discuss it, okay? Oh. Can everybody hear me? So we're talking about obstructive lung disease today, and I know most people know, they've heard of chronic obstructive pulmonary disease. So obstructive lung disease is a spectrum of disease that's very, very different from a different problem called restrictive lung disease. So if you think about it, obstructive lung disease simply means that the air is trapped in your lungs and it can't get out because of obstruction. Restrictive lung disease would be the exact opposite, where the air can't get into your lungs because your lungs are too stiff. Today, obstructive, maybe some other time we'll talk about restrictive. So when I talk about obstructive lung disease, I divide it into a chronic type of disease and an acute type of disease. The acute disease is better known as asthma. So I'm sure everybody here knows someone, or you have had asthma yourself. Asthma is reversible airflow obstruction. The obstruction occurs because there's inflammation in the airway. The airway squeezes down and gets tight, and the air that you're trying to expire can't come out. That's why people, when they have an asthma attack, you see them trying to catch their breath, and you hear the wheeze. The wheeze is the air being forced out of the lungs because of this bronchospasm. Normally it takes about 1 second to empty your lungs, 2 seconds, 3 seconds. People with asthma, it could take them up to 5 or 6 or 7 seconds. And by the time they're ready for the second breath, that first breath hasn't gotten out. So it stays trapped in there, and that's what causes the shortness of breath. So it's inflammation causes wheezing, shortness of breath, chest tightness, and cough. Those are the symptoms of asthma. Not everybody who has asthma wheezes, and not everybody who wheezes has asthma, but about 90% of the wheezing you can attribute to asthma. It also, asthma has reversible airflow obstruction and excess mucus production. So anybody that has asthma, you realize you're coughing, and you'll cough up, you'll cough and cough and cough, and a little chunk of phlegm will come out, a thick mucus plug. That's the hallmark of asthma, wheezing and mucus production. To diagnose asthma, we do a physical exam. We talk about shortness of breath, we talk about wheezing, we talk about difficulty catching your breath. Asthma limits you in almost every aspect of your life. We take a history. Most people who have intrinsic asthma, which is a problem in your body where you respond adversely or badly to a irritant in the environment, in your house, cat dander, dog dander, where you work, somebody's bad perfume. You ever walk in and get a whiff of somebody's perfume and all of a sudden you're verklempt. You can't, I used to wear this really strong, good perfume. Or what do you call it? Cologne? Cologne, all right, cologne. I used to wear this cologne, and my asthmatics would tell me, you're killing me. You can't do that. So those things tend to cause bronchospasm in people who have asthma. You find that from the history. Usually starts at a younger age. People with asthma tend to get attacks when they're around certain things, like animals or oak trees or whatever pollen you're allergic to. Those things tend to induce asthma attacks, true asthma attacks. What I'm trying to do is separate the asthma problem from the COPD problem, so people understand the difference between the two. So to figure out whether you have asthma or not, we'll do what's called a pulmonary function study. A pulmonary function study measures the flow of air in your lungs. Anybody ever had a PFT? Besides you? Stacia? Yes? So you remember, you get in the box and you blow, and you blow and you blow and you blow. And the most important thing is that you blow until the airflow stops. People with asthma have a really hard time doing that because it could take 10 or 12 seconds for that breath to stop coming out. So that's a hallmark for asthma. So then what we'll do is we'll do a pulmonary function study. We can diagnose airflow obstruction. But if you're not in the throes of, or if you don't have an asthma attack and you have true asthma, your breathing test could be normal. So anybody ever had a methacholine study? You have? They put you in the box and they gave you that nasty stuff to smell, right? So methacholine induces asthma attacks, but only in asthmatics. So if your doctor or your practitioner thinks that you have asthma and they want to test you and the PFT comes back normal, next thing they should do is called a methacholine study. They'll put you in the box, do it again. They'll make you breathe in this nasty smelling stuff and nothing will happen. Then you go to the next level and the next level. They'll test you with 5 separate levels, and if at any level you develop bronchospasm, then you're diagnosed as having reversible airflow obstruction, which is asthma. Okay? Okay, so these are the airways in a normal person. And I don't have a marker, but you can see this is muscle around the breathing tube. It's called a bronchial tube. People who have asthma, that muscle tightens up, thickens up, it swells. And now you're trying to blow air out of a straw. All your lung function comes through a little straw. So you can imagine what it feels like. You put a straw in your mouth and you're trying to breathe in and trying to breathe out through that straw. That's inflammation, which is the hallmark of asthmatic lung disease. Anybody know the treatment for asthma? If you had an asthma attack, what do you take? A puffer, what? If it's really bad, you get the epinephrine, but before it gets to that point, most people take a puffer called albuterol, right? Right. Albuterol is not the treatment for asthma. It is not the treatment for asthma. It's the treatment for shortness of breath.
So why do they give her that?
Because it makes you feel better. And that's okay, but it doesn't fix the asthma problem. So albuterol does not fix that swelling of the bronchial tube. It just opens the bronchial tube up. So inhaled steroids, a different kind of inhaler called an inhaled steroid, Flovent or budesonide or whatever. I guess what I'm trying to tell you is that if you have asthma and the only medication you have is albuterol, you need to talk to your provider and let them know that you need a breathing test to test for asthma, because if you have asthma, you probably need to be on more than just albuterol. Albuterol is considered a rescue inhaler. It's supposed to rescue you from shortness of breath. But it only rescues you for 2 hours, or 3 hours, or 4 hours, or 6 hours. It comes back again, and again, and again. The breathing treatments that fix this don't necessarily do that. They'll get rid of the inflammation and make it better.
Well, you're going to have to write that down.
I'll write it down.
Before I can get to my niece, because she does a Budol and she has a, what you call them, machines.
The nebulizer.
Yeah, but
Yeah.
she's so hard-headed, she got a cat.
Yeah, well, let me tell you a story, okay? I used to work. I worked at a hospital where a young woman came in. She was on television, like you guys back there. She was about 25 years old, a really pretty young lady, very intelligent. She came in with an asthma attack. And she had been using albuterol over and over and over and over again. And by the time she got into the ICU, she couldn't breathe at all. Okay. We had to put a tube in her throat and put her on a breathing machine to breathe for her. But her asthma attack was so severe because of the albuterol she had been using over and over for week after week, we couldn't make her breathe. So the pressure that came in through the tube blew her lung up. She had a pneumothorax. So we had to put 7 chest tubes in her, 7 tubes in her chest to drain the air out of her chest. And after about 7 days, the steroids worked, and we were able to get her off the tube, and she was back on television a week later. But she came that close to dying.
Well, they admitted her at the hospital because she had an asthma attack. They kept
Right.
her for 3 days.
Right.
And she's out now, and she does that thing, that, whatever it is, you know, that, a Budol.
Oh, through the nebulizer?
Yeah.
Right. Well, she probably needs to be evaluated for treatment so that the asthma attack doesn't come back. The albuterol helps you breathe, but it doesn't fix the inflammation.
Because they come and they go.
Right.
I don't know
That's right.
what she's doing to make it come on.
Well, you got to get rid of the cat.
I know that's right. She ain't gonna get rid of that. She's hard-headed.
Well, ask her doctor to see if they want to do a spirometry on her, a breathing test to see if she has asthma, and then treat it.
Okay.
Okay. Questions?
Is that hereditary?
Sometimes,
My brother has.
not always.
Butch has asthma.
Where's Butch?
Right there.
Hi, Butch.
Now, what is it?
You have asthma, Butch? You have asthma?
Yeah.
Or do you have COPD? Asthma? Yep. Okay.
My daddy had it.
It could be hereditary for sure.
But you wait till he'll
If
be
you
old.
if you inherit the gift of smoking, it certainly isn't hereditary.
He don't, but he didn't have asthma.
Never?
He was old.
Yeah. As a child, he had it too?
No, old, when he turned, how
Well,
old was you?
asthma comes in two types, I think, childhood and adult. So,
Well, anyway.
ma'am, you had a question back there?
Yeah, what is exercise-induced asthma then? Like cold air?
So that's considered a type of asthma, but what it really is reactive airways disease. So your airways react to a stimulant like usually cold air or exercise. That is treated with albuterol because that's not true inflammation, it's just spasm. But you have to make sure it's not asthma, that it is reactive airways. So, ma'am?
Do children that have asthma, can they grow out of that, or?
Well, yeah, there are certain things that allow children to not react the way they used to, but usually children who have asthma develop asthma later on in life as well. So they get out of the severe reaction that they have to it sometimes, but I think they're still always reactive. They develop reactive airways disease to running or to exercise or to things at work tend to induce them to develop more asthma. But yes, they can outgrow the need for the treatments.
Yeah, I had asthma as a kid and just grew out of it. I remember having one asthma attack and going to the ED.
Yeah, how was that? Bad,
I
right?
remember running in my mom's
Yeah.
arms to the emergency room.
Right. Bad stuff. Okay. So what is COPD? Chronic obstructive pulmonary disease. And as I said before, COPD is a spectrum of disease. Somebody doesn't really have, I have COPD. Well, what does that mean? To me, there's two types of COPD. There's chronic asthmatic bronchitis. So now we're talking about the chronic asthma. Chronic bronchitis that occurs with COPD is at one end of that spectrum. At the other end is emphysema. I know very, very few people who have pure emphysema, and I know very, very few people who have pure chronic or have pure chronic bronchitis. People have together the mix of them. So it gets confusing when you come in and one doctor says, oh, you have COPD. And then the lung doctor says, oh, you have emphysema. And then somebody else that's an allergist says, oh, you have chronic bronchitis. Well, you probably got it all, but it depends on which one of those is the most prevalent. So,
But do they explain that to you?
I do,
Yeah, you do. I mean, but you know, like you said, they'll tell you got COPD.
right? Right?
Say this and say that.
Do you ask them? You have to. You got to put them on the spot. I'm not saying meanly, but simply say, I don't understand what that means. Explain it to me. That's their job, is to explain the disease process to you, right? So we'll talk about it today, and then you'll know, and then you can ask them. So COPD, we talked about reversible airflow obstruction. COPD is incomplete reversible airway obstruction. There's damage now to the tube. It's not just inflammation and swelling. There's damage to the tube that squeezes down, and then that tube stays squeezed down. It leads to what's called hyperventilation, air trapping, and loss of lung function. If you can't get the air out of the chest, it stays in the chest, and then the chest tends to expand over years, and you develop air trapping and hyperinflation. If you ever see somebody that has really, really bad COPD, they're hunched over. Why do they hunch over? Why?
I said, my niece got that too.
Well, you hunch over because it's easier to breathe when you're hunched over. Easiest way to breathe if you have COPD is like this. Because the lungs tend to move easier The diaphragms tend to move better. The lungs get big, they get hyperinflated, air can't move, so people can't breathe. If you look at their back, some people's lungs are this long because they've expanded down because of this COPD and emphysema. So, it's a spectrum of disease, as we talked about. Chronic bronchitis has airflow obstruction, mucus hypersecretion. Emphysema has permanent damage to the air spaces. So what does that mean? It means that the air can't come out in chronic bronchitis and emphysema. Chronic bronchitis can't come out because the airways are inflamed and there's a bunch of mucus. People who have chronic bronchitis are always big hawkers, right? That's chronic bronchitis. Emphysema are the guys with the big chests. They just can't breathe all the time. Emphysema damages the lungs so that those, at the bottom of the breathing tube is a sac where air exchange occurs. The lung does two things, right? It gets rid of carbon dioxide and it gets oxygen into the system. And when those air sacs, the alveoli, get damaged, they don't do what they need to do anymore. So now you're talking about an inability of getting oxygen in and an inability of getting carbon dioxide out. So if you ever go to the hospital and they say, oh, you have chronic hypoxic respiratory failure, it means your oxygen level's low. You have chronic hypercapnic respiratory failure, it means your carbon dioxide level's high because the lungs aren't doing what they need to do. So now you have to treat not only your emphysema and your chronic bronchitis, but you have to treat your low oxygen levels. What's the treatment for low oxygen levels? Oxygen, right? Right. So let's talk about oxygen. How do you know if you need oxygen or not? You don't. You don't know if you need oxygen or not. You know if you're short of breath, but that doesn't mean your oxygen levels are low. And you might not be short of breath, but that doesn't mean your oxygen levels are good. The only way to know what your oxygen levels are is get them tested. You have to have them tested when you're sitting here talking to me. You have to have it tested when you're walking around. You have to have it tested when you're sleeping. Because the sleeping and the walking around is when those oxygen levels fall. And you could check your oxygen levels sitting right here, right now, and it could be 94. And you could walk out and walk back to the bathroom, it could be 84, and you'd never know it.
Is that right when you fake, because you're not getting oxygen?
Sometimes, that's exactly right. That's right. When you don't get oxygen to your brain doesn't work very well. Your brain and your heart.
Does that make you lightheaded?
Absolutely can. Yep. But breathing fast makes you lightheaded too. Because breathing fast makes you get rid of that carbon dioxide fast, and then you can pass out from that. But the oxygen is the most important thing. Because your brain and your heart cannot function without oxygen. That's why you hear about a lot of people dying in their sleep at home, or they had a stroke. That means the brain didn't get the oxygen. They had a heart attack because their heart didn't get the oxygen. So if you have heart disease, if you have stroke disease, you got to make sure your oxygen levels are good when you're sleeping. And if they're not, you have to wear oxygen. Okay. Is that different than a CPAP? Is that what you said? What's a CPAP? I have one ear that works. What is it? Yeah, so it's a continuous positive airway pressure, right? Right, so that means you probably have sleep apnea, right? That's a different kind of obstruction. That obstruction occurs in the upper airway, so that when you sleep, you're not moving air, right? What you're doing is you're trying to suck air across a really tight airway. Well, think about how that feels if you try to do that. Try to go, it hurts in your chest, which means when she's sleeping, no offense, ma'am, I hope you don't mind me talking about you, but when she's sleeping, her lungs are working extra hard to try to get that oxygen in, and it doesn't work. So snoring is usually associated with sleep apnea, but if you watch her sleep without the sleep apnea machine, sometimes she won't breathe. She'll snore and then she'll go, right? And then all of a sudden you go,
They tested me for an hour.
and?
I quit breathing 36 times.
That's your AHI was 36. That's not good. You got a CPAP machine?
Mm-hmm.
You wear it every night. Do you drive with your eyes closed?
Yeah.
You do? Just once in a while?
Yeah.
Okay. But the point is that there are lots of things that can make your oxygen levels low. Sleep apnea is one that does it when you're sleeping. But even without sleep apnea, you can have low oxygen levels just because you have bad COPD. So, sleep apnea is a disease that people don't think about very much, but it is a killer over time. 10, 15 years with it untreated, you wind up having heart failure, stroke, heart attack, swollen legs. Okay. That's just a picture of what the lungs look like. So your lungs sit in your chest, in the middle of your chest. The right lung is over here. The left lung, the heart, and all the big vessels sit right in the middle. So what you have breathing tubes that start in the middle, and they come down to the smaller tubes and smaller tubes and smaller tubes, all the way down to here. Those things are called alveoli, and they're little sacs of air where the oxygen and the carbon dioxide exchange. Oxygen comes in, carbon dioxide goes out. That's what they look like when you have COPD or emphysema. They coalesce, they get brown, they get nasty looking. You can imagine you can't get mucus out of those things. So guys that have, and ladies who have significant obstructive lung disease, they cough, they cough, they cough, until they turn purple in the face, and then a little piece of jelly comes out and they feel better for an hour or two. But we know what the major cause of COPD is, right? It's smoking? Yes. Okay. Yeah, it can be green if it's infected sometimes. Okay, so what's the etiology or the cause of COPD? Well, number one is smoking, and number two is smoking, and number three is smoking, right? Then after that, we have other things that can cause it. Most people who have COPD, emphysema, are smokers. Some people are resilient to smoking or resistant to smoking. Their lungs are resilient, meaning I've had people who are 90 years old and smoked a pack and a half a day, and they came in and their lungs were perfectly fine. But I've had other people who were 50 and smoked a pack a day for 20 years, and they had to be put on a lung transplant list because their lungs were dead. So it depends on how you respond to smoking, but I can tell you that no one responds well to smoking. Okay? And what I say about smoking is it's your choice to do what you want to do. And I think you should be able to do anything you want to do within reason, doing it without the addiction. I can't think of the word I wanted to use right now. In moderation. You should be able to smoke in moderation. Who can? No one. Because tobacco, nicotine is so highly addictive that you can't smoke a cigarette a week or 2 cigarettes a week, go to the bar on a Friday night and have 3 cigarettes and not smoke anymore. You can't do it. You get addicted to it. So unfortunately, unlike other things, the addiction of nicotine is bad enough and it's actually socially accepted enough that many, many people get addicted to it and then just wind up. What's that?
Smoking's a drug then, right?
It's harder to get off of smoking than it is, I think, alcohol. I think. There are certain drugs that are easier to get off of than nicotine because it's accepted. If you see somebody sitting outside smoking, you're not going to say anything, hey, what are you doing? But you see them doing other things, you might say, hey, yes, ma'am.
I had a question. Does the tobacco, do you think the tobacco of today is more addictive than yesterday's tobacco or years past?
No, you mean, are they doing something to the tobacco to make it more addictive? I don't think so. I just think nicotine is nicotine. You're addicted to nicotine. That's why people who vape, you know, oh, I'm not smoking, I'm vaping. Yeah, you're vaping nicotine. So yes, you are addicted to nicotine. And I'll tell you something else too. If you're vaping something that smells funny, sweet, really good, that's even worse than cigarettes. Well, they have these vapes that they put strawberry or banana cheesecake or whatever kind of thing, and you vape it in, and it tastes like that. So you're getting your nicotine and you're getting your fix from sugar, I guess. I don't know. But that stuff has glycerol in it. What? It's true.
Does that include cigars too?
I'm taking the fifth on cigars. Yes, cigars are very bad for you. Now, cigars are something you can do in moderation. You can smoke a cigar a week and not necessarily be addicted to it. But if you're smoking cigars like you'd smoke a cigarette 3 or 4 or 5 a day, then absolutely. It's probably worse than cigarettes because of the amount of nicotine and tar in the cigar compared to a cigarette.
What about snuff?
Snuff. Is that like chew?
Yeah, do it back, yeah.
Yeah, well, I'm a lung doctor, so you chew all you want. No, I'm joking. Nicotine, wherever you get it, is a problem. So you're just changing one problem for another. Oral cancer, ulcers, gastric cancer, bladder cancer, all go along with this nicotine. So ma'am, to answer your question, I just think nicotine in and of itself is bad. These vapes do tend to make more nicotine per the amount that you're vaping, so they could be worse now. But I just think...
Vape shops, is that set up so you go in and vape, or you just...
No, I think you go in and buy the stuff and vape it somewhere else.
What's that other hookah?
Hookah? Yeah, that's a crazy thing. That's, what is it? You never watched a television show where they got this big water pipe on the thing and they're all sucking on this thing? They're just getting nicotine in a different way. Hookah, right? Yeah, I know. I've never tried it, but it looks nasty. Yeah, I agree. Ma'am. Yeah.
You don't inhale cigars.
Yeah, I know. That's what they tell me. And I agree with you. If I agree with you, I'm not going to incriminate myself here. I agree that once in a while you could smoke a cigar, like I said, in moderation. But cigarettes, you can't do that. And yes, theoretically, my father smoked cigarettes forever. Okay, and then when he finally got off the cigarettes, had his bypass because the cigarettes caused his heart to fail, he smoked cigars. He was still inhaling it. Well, he didn't want to, but I mean, you get used to it and you do it. Then he went to that snuff we talked about. Then he died. Yes, ma'am.
What about when people smoke and don't inhale it?
That's Bill Clinton you're talking about, right? Yeah, if you could smoke and not inhale, it would be a lot less of a problem. But they still get the problem in your mouth, in your airway, in your stomach, because you do swallow air too. So smoke is not good for you no matter which way it goes. Ma'am?
I smoked for a long time, and it took me a long time to quit.
Right.
Every New Year and every Lent season, we would give it up. About 4 of us was doing it.
Wow.
And it took us about 4 years, but if we hadn't quit when Lent season came, after we didn't quit in January, we would keep doing it every year, and it took us about 4 years to quit. But I never learned to inhale until I was probably 35, 40 years old before I learned to inhale. And somebody told me, said, stand in the door when the wind is blowing in your face.
Didn't you inhale it?
I almost passed out.
Excuse me. Well, what I can tell you is that the average person has to try to stop smoking 7 times. 7 times they have to try before they're successful. You were 4 times or 8 times if you did it twice a year. So that's what it takes. Good for you. Okay. So other environmental agents, outdoor pollution, indoor pollution. You know what indoor pollution is? You know they make buildings now that are so airtight that there's no circulation of the air? And they have to have air, not purifiers, but air exchangers to exchange the air in the house. So all the things that don't belong in the house stay in the house. That's indoor air pollution. And right, you're supposed to have. No, I'm okay, thank you. You're supposed to have some airflow. The air is supposed to turn over in your home 4 to 8 times an hour. So a lot of places don't have that, so you have to be careful. You're working in a newer building, that's those high rises. They tend to have indoor air pollution. Workplace exposure can also cause it. Anybody worked in a coal mine, foundry, quarry? Anybody in the Navy? Where'd you work, sir? Foundry? Yeah. Yeah. So different types of diseases, but certainly you can get pollution in your lungs from foundries, from glass factories. The guys that were in the Navy, like my father, they get exposed to asbestos. Asbestos and smoking is terrible together. You heard the commercial on television for mesothelioma, if you have mesothelioma. Right, well that's what it's about.
What about aluminum?
Who said aluminum? You? Aluminum probably doesn't cause a whole lot of problem unless you have an allergy to aluminum. Now, if you have an allergy to aluminum, which people, and let me analogy like you sneeze, and I'm talking about if you get aluminum in your lung, some people have an incredibly bad reaction to it. Those are called occupational exposures, and if you have that kind of problem, then you need to be away from the aluminum. Other things that cause it, bisonosis, people that work on farms that are exposed to silage, some of them are allergic to it. It's called hypersensitivity pneumonitis. So everybody would get sick from aluminum, but some people would die from aluminum because they have an allergy to it.
What about work around chemicals?
Chemicals the word chemical means poop, means terrible stuff, right? That's what chemicals mean. You don't want to inhale them, get them on your body, but absolutely. You're finding out more and more that guys that were, I don't even know what the word is, they work on machinery, so they got that oil in the air and all that kind of stuff we're finding as long-term effects on people's lungs. Problem is you don't find it out till later. I had a patient that worked in a popcorn factory. You know, she was allergic to the stuff that went on the popcorn, that fake butter. So she developed a disease, and that disease is actually called popcorn lung. And you get it from working in that place. And the same stuff that they put on that popcorn is the same stuff that's in that foofy vaping stuff, glycerol. And if you're allergic to it, it causes your lungs to develop an incredibly bad reaction to it.
What about chlorine?
Chlorine's terrible.
Okay.
Chlorine is a killer. Chlorine gas, terrible. That's what they used in World War I. You weren't around then, were you? World War I? Chlorine.
I was in the making.
Chlorine gas is a killer, but it destroys the lung, but it also destroys all other parts of your body, your liver, because it gets absorbed into your body and it binds with things it shouldn't bind with. So, yeah, chlorine's terrible. Ma'am?
Don't we have chlorine in water?
I'm sorry?
Don't we have chlorine in water and in our clothes and all kinds of stuff?
Yeah, but you're not snorting chlorine. I mean, the amount of chlorine that's in the water is minimal. It's just enough to be bacteriostatic, so bacteria can't grow in the water. But we're talking about a chlorine leak where you're exposed to pure chlorine that's inhaled. What's the other stuff that the farmers use? Ammonium nitrate, right? That stuff's a killer. They put it on the farm, they do okay, but if they get exposed to it, you die from it. Your question, ma'am, I'm sorry.
What about welders?
Terrible. Welding fumes are terrible.
I know they are.
Yeah.
I used to work in an office, and they had a welder out beside my office. I go to sleep every afternoon. When there's out there welding,
You mean
fumes
that?
are coming in.
Well, those fumes are not good for your lungs. But there's lots and lots and lots. If it stinks, you probably shouldn't be breathing it, right? Okay. And then we talked about, somebody asked about genetic risk. There is an emphysema that is purely genetic. And you can develop emphysema at a very young age if you have that genetic profile called alpha-1 antitrypsin disease. So alpha-1 is a disease where your body doesn't make a chemical that your lungs need to keep clean. Anybody know what trypsin is? Nobody? Anybody use meat tenderizer? When you get the meat tenderizer, look on the label, and one of the things that's in it is going to be trypsin. Trypsin is an enzyme that digests muscle. Okay? What? Trypsin, trypsin. It digests muscle. That's why you put it in the meat tenderizer. If you leave it on there for a day or two, it makes the muscle, breaks down the muscle, makes it easier to eat. Your body makes trypsin and puts it into your lung. And it is there to destroy any of the junk that you're breathing in, dust, mites, whatever you get into your lungs that don't belong down there. And it destroys that protein. But left unchecked, it'll destroy your lung. So your body makes alpha-1 antitrypsin. And they make enough of that so that when the trypsin's done eating what it's supposed to eat, it doesn't eat anything else. People who don't make alpha-1 antitrypsin get a disease called alpha-1 antitrypsin deficiency, and they get emphysema at the age of 30. So anybody that you know that has emphysema and is young should be tested. Chances are they don't have it, but they may be a carrier. If they're a carrier, then their kids need to be tested, and their kids, because once in a while, one in about 1,000 will develop this antitrypsin disease. And if they find it before they're 30 or 40, you can save their life with medication that you give them the alpha-1 antitrypsin. So, interesting, huh? So the diagnosis is made by the symptoms, the physical, the pulmonary function studies we talked about, imaging, x-rays sometimes can lead you to see emphysema on the x-ray. Understand that just because a radiologist says, I see emphysema on the x-ray, doesn't mean you have emphysema. They're looking at a specific pattern on the x-ray, doesn't mean you have emphysema. Everybody here, if you had no other medical problems, would die of emphysema when you're 150 years old, because your lungs just get old, and old lungs get emphysematous. But you have enough function, as long as you're not smoking, to last you forever. Okay, you're not going to live to be 150, so something else is going to get you before your old age of your lungs does, right? Are you planning on it? 150? Yeah, me too. Okay. You need to have an oxygen evaluation. We talked about that. So you check your oxygen when you walk and when you sleep. And then if you have it bad enough, your oxygen levels are low enough, and your sleep is disrupted enough, you look for obstructive sleep apnea, because quite a few people who smoke get obstructive sleep apnea. Okay? Comorbidities, you know what that means? Doctor says you have a comorbidity. It means other problems that you have that are in your body that are going along with your obstructive lung disease. And heart disease, diabetes, GERD, which is reflux or heartburn, gastroesophageal reflux disease, bone disease like osteoporosis, and anxiety disorders all tend to manifest in people who smoke a lot or have emphysema. You can understand the anxiety, right? If you can't breathe, you get anxious. So if a doctor says, oh, you're only anxious, you say, damn right I'm anxious, I can't breathe, right? Because sometimes the anxiety will cause your COPD attack, and sometimes your COPD will cause your anxiety. Either way, the breathing is getting worse, so it's not something to overlook. Okay? Treatment. So we talked about the treatments for asthma. We're going to talk about the treatments of COPD. They're about the same, depending on the extent of the disease process. The bronchodilators are albuterol. Okay? Albuterol is a bronchodilator. It opens you up. People who have just emphysema need bronchodilators. They will not get in trouble if they use the bronchodilator. They're not going to get, like the asthma people can, get their lungs tightened up too much. Bronchodilator is a hallmark of treatment for emphysema, and a lot for chronic bronchitis as well. Corticosteroids are steroids. You inhale them. You ever hear of these fancy medications they put on television? Brio, Breztri, Trelegy. They all have a long-acting bronchodilator and the steroid. So you get both at one crack. Problem is they cost about $800 a month. So yeah, we have to work on getting those for you. Oxygen therapy should always be checked for oxygen therapy if you have COPD. PDE4 inhibitors are newer drugs. I forget the name of the drug, but it is used in end-stage COPD to help you breathe a little bit better. I don't use it very often because it causes a lot of diarrhea. If you can't breathe, you don't want diarrhea. Then there's other things for mucus clearance and then endobronchial valves. We don't use those very often. So, oh, get off of that. Okay, are there any questions?
We need to know how to get in touch with you.
Okay, there you go. You can keep clicking on that if you want. Yes, ma'am, I'm sorry.
Are there any bad effects of the sprays that we use?
Yeah, sure. Albuterol, it's a good question. Albuterol is called, do I need this? Can you hear me without it?
No, I don't need it.
Okay. So albuterol is a bronchodilator, and it opens up your breathing tubes. But it also makes your heart beat fast. Okay? So if you're using a lot of albuterol, you might feel really anxious and jittery and nervous because it makes your heart beat faster. It opens up your airways, makes your heart beat faster. Steroids, the inhaled steroids, have very few side effects. The biggest one's going to be thrush in your mouth. So if somebody puts you on an inhaled steroid, we talked about the names, there's lots of them, but Brio, Trelegy, Breztri, Flovent, all those drugs have steroid. If you don't get it out of your mouth, it'll cause you to have thrush. So after you use those kind of medications, you need to scrub your mouth. Doctor will tell you to rinse it. It's not enough. You need to scrub your tongue, scrub your gums, gargle. What else? Sometimes some of the medications, if they have other medicines in them, will make it hard for you to pee. So if you have a prostate problem, guys, and you're on these medicines and you find it harder to pee, tell your doctor, because one of those medicines does that. Can also make your vision a little bit blurry if you have cataracts, ladies and men. So there are some side effects, but very rarely are they side effects that stick around, and they're pretty easy to get around if you know which one's causing the side effect. Any other questions? No? Well, thank you. All right, well, thanks for having me. Appreciate it.
Thank you, Dr. Vacca.
My pleasure.
Marlene Lindsey, and she's going to come up and tell us a little bit about the Wayne County Black Legacy Project.
About what?
Give it to me now.
Good afternoon, everyone. Can you hear me now? Yes. Okay, about 2 years ago, I've been to the museum on multiple occasions prior, but about 2 years ago I went. And it's still the same thing. I really didn't see anybody that looked like me. I've seen Louis Armstrong, which I mean, that's wonderful, but like detached. So it's like, how can I know that the black people of Richmond have made a contribution to this community. And so I started doing research to see what had we actually done. And many of you here I've contacted to get information from your relatives and from yourselves about that, because in my project I'm cataloging and have the different categories, and I have talked with the museum, and in 2023, June coming up, they have agreed to put my work on display. So we'll be able to go and see, and I have categories. I mean, I didn't know we had actors. I just found out last week that Pat Dawkins' daughter is a judge in Marion County. I did not know that. So, I mean, there's so many things that the people of Richmond, born and raised here, or that have come in and have led lives here that have been very productive, have did and have really made a contribution not only to this county or this city, but far beyond. So I'm asking each one of you, I can't think of everybody, I need help, it takes a village. If there's someone that you know of that has made a contribution from your family or somebody that you've worked with, please let me know. On the back table, like I did not know when I was coming up, there was Dr. Brooks, Dr. Gibbons, Dr. Smith, but back there on the table, if you go back and look, W.G. Huffman was a city position for 22 years. A black doctor, and I have him back there on the table. So I mean, that's very, just, to me, it was rewarding, and it was, when we go to the museum, when the kids come through, they can go, wow, somebody in Richmond became this, and I can do that too. It's somebody that they know, it could be somebody's relative or cousin or grandfather or something like that, so it's really important. The last thing was, I did an article from the Western Wayne News, and from that, a girl at Star School seen that article, and she has invited the Black Legacy Project to put up a bulletin board in Star School about the accomplishments of the blacks, and for me to even go talk with the kids. So to me, that's outstanding, and I'm not relegated to February, and that is a win to me, not just Black history. So again, take a look at the table, because it was Medical Monday, I have a book on the other medical people. There's other people that I have contacted and I'm still waiting on information. But if there's anybody you know, please urge them to get me the information, because we have from January till June to get the displays together so that we can have a fantastic showing at the museum. Real quick, I want to say, if you haven't seen it, on my board, I just got the board and I just got approved for a 501(c)(3). So that's and Linda Cottingham in the back is the secretary on the board. Yvette Baker and Mary Jo Flood are co-treasurers. Nathan is part of the communications team because I need help with the internet. And the energy of the youth is just absolutely wonderful. Does anybody have any questions? Yes.
I just want to make sure that you probably have some historic information about your family members, and make sure that Marlene gets that, because like I said before, she posted something on their Facebook page and it was a picture of my grandfather that I'd never seen before. So you probably have things that you might not think they're important, but they're important.
And I do want to thank Bobby Bowen and the different ones, because he did donate his uniform. So under the firemen, I'll have that. So if you have any artifacts, please, because when the kids go through, I mean, if they don't want to do a lot of reading, they want to look.
Yes.
So what you have, you know, you may feel is insignificant, but I've gotten some badges from, police badge from Marion Williams. Denise donated that. So please, thank you.